back, everyone. I would like to welcome today a good friend, James Carroll, all the way from the UK, who invented this beautiful machine, the Novothor, and of course before that the Thorlaser, amongst many other things that he does. I want to start today's interview with asking about the special events of last year, because I know you speak at many events and many universities and you do a lot of research, but last year was a pretty special year for you. Can you tell us a bit more about those two major events that were quite important, milestones?
Yeah, two milestones, yes, from last year. One is that the United Kingdom National Institute of Health and Care Excellence started recommending our photobiomodulation treatment for cancer patients. So this is treating the side effects of high-dose chemotherapy and radiotherapy. The side effects are severe, and this treatment is successful in reducing those. And then the other sort of landmark item is that we got to do a congressional briefing in the United States. This is part of trying to convince Congress that they should be funding medical device and hopefully photobiomodulation devices as an alternative for opioids. You know, the United States, it's on the news. I mean, it's across many developed countries there is an opioid crisis.
Absolutely.
And they need alternatives, and so we were there to persuade them that this therapy should be considered in the list of things they want to fund research on.
And how was that taken?
Extremely well. It's meant that we're going to be very busy this year. We've already got 5 government level and in medical insurance companies, and medical insurance companies to meet over the next few months as a result of that meeting.
Beautiful. And I guess the natural leading question from this is, you already have enough science and validation on this specific subject, pain, chronic pain, let's be specific now, on musculoskeletal chronic pain. They must have seen enough of that evidence that's already collated and what's called, agreed upon science, basically, that it does work. So it's not just anecdotal, I feel better, therefore.
Absolutely.
This is
so when the National Institute of Health and Care Excellence do their reviews, yes, they're looking at large amounts of data. So we were able to show them 40 randomized controlled clinical trials.
Fantastic. And those people who are in chronic pain, and I'm talking from personal experience, where I was before going into the Novothor quite regularly and getting rid of all the medications and their side effects, which even if the pain is gone, but your brain is also gone, you can't function properly.
Absolutely.
Let alone being in pain and knowing, or to be specific, not knowing when this is going to end. Will I ever be better? Will I be able to function and do my profession, do what I love, do whatever you love doing in life? That by itself, that state, leads you into depressive states, anxiety states, etc.
Suicidal states.
Suicidal states, and we have a lot of suicides here in New Zealand, especially amongst men. As well as the known side effects of the medications, as well as the fact that the inflammation, which is causing that chronic pain, is still there, we're just hiding it. So all of these things massively disturb the quality of your life, let alone the longevity of your life. We don't know what's going to happen, but we know the quality of life from the state of your mind, the state of your chronic inflammation that's spread to the whole body, and the side effects of the medications. All of these things for that person have to be resolved. And this is a need, this is not an aspiration. This is a need. We need this to be done. So you're telling me, and I know it from my personal experience and the studies that I've read, but you're telling me that more of us professionals, healthcare professionals, are seeing the light and seeing the evidence, and agreeing that this should be standard of care.
Yes,
from now on.
Scientists have known for a long time that this is good, and it's certainly been a major area of research for many universities. It's just taking a longer time to move from a university setting to a clinical setting, and there are pioneering and more open-minded and more curious medical doctors, dentists, and therapists who are finding out about this. But it's been incremental. And now with things like the United States Congress taking an interest, and government institutions like in the United Kingdom, the National Institute of Health and Care Excellence, recommending these treatments, that should change the trajectory from incremental to a sort of rocket ship.
Fantastic. And I guess that will open the doors from the mass infiltration perspective of the whole photobiomedicine. Starting with the pain, because it's the most obvious and most immediate measurable outcome, and most evidenced as well, into other areas of not necessarily immediate need, but more aspirational desires of human optimization.
Yes.
Optimizing brain performance, optimizing physiology, optimizing muscle building, etc., etc. Any visions for where that's going in the near future from what you already know scientifically versus what you foresee as coming?
So in terms of using it as a preventative medicine, the areas where the most work has been done is in sports medicine, or rather in athletic, what's the word I want? It's not medicine yet, because we're treating people, but they don't have an injury, they're not a patient. So is it a
aspirational rather than...
But we know what it does. There's over 60 randomized placebo-controlled clinical trials on athletes, looking what it does for their strength, for their recovery, and their ultimate performance.
Yes.
So, or should I say, strength and endurance and recovery. So that's been very well documented now. So this is helping them do their, obviously, extreme work, and why not? Wouldn't it help, if you like, ordinary people?
Mere mortals.
As mere mortals, regular mortals.
You mean, I'm not Usain Bolt. Oh, come on.
So, regular mortals,
yes.
In their daily lives. And it's quite clear, I mean, from those of you who are lucky enough to have access, like, people who work at our office have access to a Novothor, that it does have an effect on how you feel, just generally energy, sleep, small tasks like it could be climbing several sets of stairs. If you're kind of late middle age and you've noticed you're getting puffed when you kind of go up a couple of sets of stairs, somehow it's much easier. What's happened?
Absolutely.
So people's vitality and people's sleep seem to be anecdotally very much improved by having a whole body treatment. So that's anecdotal so far. We've just added a new feature to this, which is for universities, which is for a placebo treatment to be delivered. So to prove this academically, you've got to have randomized placebo-controlled clinical trials. And in the next few weeks, we will actually be starting to ship to universities a version of this with placebos built, a placebo kind of button built into it, so that.
How would that work though? Like,
well,
if the red light doesn't go on.
Thank you for asking the question.
How do you know that it's not placebo? Because
okay,
it didn't
so
work.
what we've done is we've built some heaters into this. So with this much light energy we put in, there is some warmth, as you know. So we've actually had to put some heaters in alongside the LEDs, and when the LEDs are not on, we get heat coming out instead of the light to give a fake kind of treatment. It makes all the normal bleeps and noises and vibrations,
but also a red light
as well. But no red light coming out of the machine. The patients in the Novothor will wear a special pair of goggles, and the goggles have got LEDs built into them, and they shine LED light towards your eyes. And when you lie in there and this thing comes on, you get the feeling that there's light all around you, and you don't know. And both the active and the placebo patients both get it. They both have the same experience. These goggles are tightly fitting around the eyes. They've got very dark lenses in, so you can't really see. And they are designed to filter out the red light, so you can't see the lamps come on. And you do get this feeling, regardless of if it's in your active or placebo mode, that you're getting a real treatment. So it feels like it, it sounds like it, it looks the same to both parties.
Yes. Perfect. Well, that would be a great step forward.
Yes.
To prove to, I wouldn't say naysayers, but a lot of people who want to see evidence first before believing, versus people like us who believe first and then create the evidence to prove what is visible.
To verify, yes.
Yeah, to verify, we know it, we can see it, we can feel it. We understand the quantum science of it all. Well, fine.
Well,
let's prove that scientifically.
There's a word that doctors often use to describe, I've seen it with my own eyes, and they call it empirical evidence. It's like I've seen it. And people, it sounds like a great science word, empirical. It just means by observation. In other words,
and by agreement.
Yeah, and by agreement.
I observe it, you observe it. Do we
Yeah.
agree it's empirical?
Yes.
If we don't, it's not empirical.
Yes.
But has it happened?
So it sounds great. So when a doctor wants you to dismiss something, they'll say, "Oh, that's just anecdotal."
Yes.
And yet, when they see it themselves, they call it empirical.
Amen. Amen. I mean, I always use the analogy of the simplest and most core fundamental science of all sciences, maths. 1 + 1 = 2. Well, technically, if you speak to a true mathematician, and I did, that's not absolute truth. It's just what we agreed upon as a system and a method to measure units so we can move forward and have a method of analysis, which I'm fine with. I'm grateful for that. But it isn't absolutely so, because technically 1 + 1 = 2. 2 units of 1 make a new unit of 2. That's another unit, that's another 1.
No, you're playing
we can go and philosophically analyze this. Yes, we have to come to agreements, but nothing is absolute empirical evidence. Ultimately, the evidence, especially with human healing, we're not going to talk about treatments here because you're a scientist, not a doctor. I'm a doctor, but not a doctor of everything. So I don't want to talk about every single disease as if it's a separate thing. Technically, most diseases in the human body are the same, due to the same causative factors, a breakdown and imbalance in the normal physiology. Cellular physiology, within a tissue, within a system, the whole thing starts to break down, affects other systems, because everything's nothing more than a biofeedback loop, basically. So how about we talk about healing in general, rather than treatment for one labeled disease at a time. And healing comes in many ways, but primarily through biosignaling. The cells biosignal to each other within themselves. Mitochondria biosignals to the nucleus. One cell.
Then there's gene expression and things happen. So yes, signals to the nucleus, gene expression. Downstream effects of that is that proteins do things, and more proteins are made perhaps, and then downstream of things, you start making new tissues, or you make
and they're either good tissues or bad tissues.
Make
cancers.
You make maybe the lymphocytes or the neutrophils that attack diseases. So yes, so this is
and good things can turn back.
Yeah,
to turn bad. Nitric oxide is neither good nor bad. Nitric oxide in blood vessels causes vasodilation. That's a fantastic thing. Too much nitric oxide inside the mitochondria causes oxidative stress. So it's not is nitric oxide good or bad, it's where and how much and so on and so forth. So we want to release it out of the mitochondria and we want to balance things out. And this is how I've seen energy healing, if you want to call it so, quantum medicine, photobiomedicine, as the method to literally balance physiology, to modulate, which is why I love the more agreed upon term now, photobiomodulation, because we're modulating things up and down. We're not cutting out a process. We're modulating and balancing out what is natural. Yes. You don't want no oxidative stress. No free radical oxygen. You want some because
we're
that's
going
natural.
for homeostasis.
Thank you.
That's what we're going for.
Some free radical oxygen is necessary for vital functioning. Too much is oxidative stress. So it's balancing out. And the only way I can see that, now we know it, now we know more through the work of people like you guys, and all the scientific, which I love. I love science, but I don't want to get stuck with people believing that if it's not proven yet, it's not true. Well, we can only prove in the future what is already true.
Well, there have been, in the world of photobiomodulation, and I just did another review of the data today, there's now 700 randomized placebo-controlled clinical trials in this field. It's huge. 700 RCTs. So it's significant, and by far, a huge majority of them have a positive outcome. So it's real, and this is, as opposed to empirical, this is objective evidence. That's scientific evidence, the way the scientists like it. So it's objective evidence as opposed to empirical evidence. That's working.
And sufficient enough for you to personally believe. I mean, I know we would have to take into perspective. Of course, you have a bias towards your creations, and I totally believe in them, and that's why I flew all the way to the UK to come and talk to you guys and push hard to get it back here in New Zealand. Would you go into this bed repeatedly for the rest of your life and recommend it to your own personal family?
Obviously, I've grown up with it. It's a difficult question because it'd be like
I know it's difficult because I know you know too much and you bias
exactly.
too much.
So that's unknowing what I know now. Because I've been in this field
yes.
for 32 years, and I've learned a lot about health and wellness. As a result of being in the field, then I suppose it would be, if I didn't have all of those experiences, I might not be somebody who would have considered myself somebody trying to worried about my long-term health. And not everybody is, and you know this. And most people wandering around your town here are probably not thinking about these things. I might have been one of those people. What would have persuaded me to do this? You were talking about people in pain earlier on, and chronic degenerative conditions, and you start, like, joints begin to hurt, for example,
which are
muscles get weak and things like that. And by the point I reach a certain point in middle age and I think, oh, I'm feeling old, I might have then thought, you know, I keep hearing about the therapy where people get in it and they come out feeling younger. I might have been persuaded about that time. I might have been quite a cynical person, a sceptical kind of person who had no insight on health, and I might not have been rushing towards it. But if I had been a health conscious person by some other pathway, then absolutely.
That's kind of the answer that I was expecting, because it's based on what you know today. I just want to take away the natural bias that you're actually part of the you started the company and all these things. So the business part aside, but the knowledge part, yes, knowing what you know today from all the science that you've seen and experienced personally.
It's part of a complete healthy lifestyle.
Yes.
Where you get diet and exercise
absolutely.
and attitude dealt with, which are three components of healthy life. You know, this is another component. If you're into a good diet, or into sensible levels of exercise, and if you're into having a good attitude, then this is another cornerstone of part of your health, well-being and personal development.
So thank you, James. Really appreciate this time, and you taking the time actually after such a long trip with, I think you were lecturing for the last 3 days in a row.
Well, try the last 3 weeks, which were Chicago for a day, and New York for a day, and New Jersey for a day, and Miami for 4 days, and Los Angeles for a day, San Francisco for 3 days, and then home for 3 days, then Greece for the weekend to do lecturing, not on a holiday, and then back home for 24 hours, and then fly to Perth and do the lecture, and then fly to Melbourne for a day, and then Sydney for a day, and now Auckland for tomorrow.
Well, thank you so much for your innovations, for your time, for your energy, and for helping us serve the world better.
Right.
Thank you, mate.
Thank you for your evangelism.
You're welcome.